Good morning, everyone. So it's a recorded video, slightly
Colleagues,
offbeat topic.
today I'll be presenting on an exciting and practical development, the integration of a tiny fingertip-sized smartphone microscope in the diagnosis of fungal keratitis, which may have immense potential in resource-limited settings. The management of a corneal ulcer presents a distinct diagnostic challenge. Previous studies have shown that the majority, over 90% of ulcers, are either bacterial or fungal in origin. This simple fact highlights the urgency of the situation. An early, precise diagnosis is paramount to initiating effective therapy and preserving vision. The gold standard for this has always been microbiology. However, the reality for many clinicians is that immediate access to a laboratory is a significant barrier, especially in remote or under-resourced areas. This is the core challenge we aim to address. So what exactly is this technology? Essentially, it's a technique that leverages the ubiquitous smartphone, transforming it into a powerful diagnostic microscope using simple, low-cost lens systems and adapters. The goal is to capture high-quality microscopic images right in our clinics. The advantages are quite compelling. Its portability and accessibility are game changers. It's incredibly cost effective compared to a traditional benchtop microscope, and importantly, it opens up avenues for telemedicine consultations and future integration with AI algorithms for automated diagnosis. Let's look at the actual kit. This is the iMicro Q3 mobile microscope. As you can see, the set comes as a flat pack which can be easily carried in the pocket or wallet. The assembly of the stand is extremely simple and takes less than a minute. This provides a stable platform which is crucial for acquiring clear, focused images. The process begins as always with the standard corneal scraping. The collected material is then carefully smeared onto a clean glass slide. Next, we prepare the smartphone microscope. The portable microscope lens is attached directly over the phone's primary camera. It has a small suction mechanism that helps it remain attached to the phone camera. The phone is then placed on the assembled stand. We use a dedicated app named iSeeing app, which provides the user interface for magnification, focusing, and illumination from the smartphone light source. Calibration of the microscope is done. Next, a specimen slide containing the corneal scraping is stained with trypan blue dye. Using a syringe, 1 or 2 drops of dye are carefully applied onto the slide. One can use the OT leftover trypan blue dye used in operation theatre for capsule staining during cataract surgery to minimize the cost of dye. This stain provides excellent contrast and highlights the fungal filaments beautifully, making them easily visible. It takes only about 30 to 30 seconds for the stain to act. Now for the actual microscopy. Remove the calibration slide from the stand. Place the stained specimen slide onto the viewing area. Manually adjust the position of the phone on the stand to bring the stained sample into sharp focus within the iSeeing app. The phone's flashlight will serve as a transilluminator. We can easily navigate across the slide and digitally adjust the magnification, here up to 240x. The image quality is quite remarkable for a point-of-care device. We can capture still images directly which are saved to the phone's gallery for documentation or sharing. The ability to scan the entire smear quickly and document multiple fields is a significant advantage for a comprehensive evaluation, ensuring we don't miss isolated filaments. And as you can see, the stained fungal filaments become clearly visible. And this is not just a concept. This technique was first reported and published by our group and was subsequently validated and integrated into routine clinical practice by a score of other reputed institutes, which is evident from a number of published studies on this topic. The technique has been validated. Our findings on using trypan blue for rapid staining in clinics have been published, showing its efficacy and utility in this very setting. In conclusion, this technology truly marks a new era of keratitis management. It empowers clinicians with immediate diagnostic capability, drastically reduces the diagnostic turnaround time from hours to days to minutes, enhances our documentation and training, and has immense potential for widespread impact, especially in resource-limited settings. Thank you for your kind attention.
It was such an amazing presentation and amazing concept.
Thank you.
Out of the box thinking. Very innovative. Very unique.
Yeah, this is a very path-breaking and innovative, very handy in the infectious keratitis. Amazing innovation, Professor Prasher, from your team. It's always a treat to...
And a lot of my sincere thanks to my residents also. And a lot of our residents, when they go back, they are not able to, continue. Though we try to teach them, at least they should be proficient in scraping and diagnosing the fungus, because 90% of the ulcers are either bacterial or fungus. That way they can start the intensive antifungal therapy. So it's a small device. It's very portable. So wherever they go in the periphery, at least they can try to document and share their
very
images.
handy, very handy.
What
at
is
least
the
for
cost
all.
of this device like?
It costs around $35. At that time, it was in manufacturing, so I was one of the crowdfunding on the Kickstarter.com. So I procured it that way, but now you can get it online on Amazon.
It's available online.
Yes, ma'am.
Okay.
Wonderful, wonderful, Pawan. Thank you so much.
Thank you, ma'am.